Hi everyone, welcome back to Neurospicy Nursing. Today we are having a little bit more of a longer form lecture video going over newborn care. This one's kind of going to be multi-part, um, and it doesn't include any of the complications. So let's go ahead and get on into it. Okay, so the neonate period, it's the period that runs from birth through 28 days. Right after delivery, our priority is going to be the ABCs, so airway, breathing, circulation. Thermoregulation is really, really important for neonates. We have to assess the umbilical cord, so we're going to look for two arteries and one vein. And we're going to make sure that we perform an APGAR at 1 and 5 minutes. Okay, so this is the APGAR table. I set it up this way, so hopefully it makes a little bit more sense to you guys. A stands for appearance, P is for pulse, G is for grimace, A activity, and R is for respirations. And then I put kind of like what kind of goes along with that with it. Um, Obviously, if they're blue or pale, they're not breathing properly. The second one is going to be acrocyanosis. This is normal, okay? If they have central cyanosis, though, and their limbs are pink, that's going to be a red flag, and then completely pink is obviously really, really good. Absent heart rates are obviously bad, right? If you don't have a heart rate or a pulse, you're not going to be able to perfuse properly. Bradycardia is a 2, but it can be a red flag. And then you want their heart rate to be greater than 100 beats per minute. You may see some places may say 110, but the textbook that I use to make these PowerPoint videos for you guys says 100, so I'm going with 100, but use that with your discretion and based on what your professor says. That's ultimately what she's going to test you on, right? Okay, so the reflex irritability or grimace. That is either like they're not responding, um, if they grimace, kind of like make a sad face or frown, or if they have full-blown cry. Full-blown cry is obviously really, really good. And then muscle tone, you want them to be able to like flex their extremities. That is the best. If they're just kind of limp, obviously not super good. And then respirations, really, really good cry. That's awesome. We want them to be crying really, really loud. All in all, just remember the scores. So when you add them all up at the end, you'll get a score. 7 to 10 is with the normal limits. That's good. If you have 7 at 1 minute and then 10 at 5 minutes, then that is perfect. Um, Anything below that, you may see another APGAR score being taken. So just remember, I think the scoring goes, I'll double check for you guys right in the description, but it should be 1 minute, 5 minute, and then 10 minutes if they need another APGAR. Okay. So post-birth medications, obviously there are medications, mostly we're talking about newborns here, but since I was talking about post-birth, I wanted to include Rogam for mom. But for any eye prophylaxis, we're going to give erythromycin, eye ointment to prevent any ophthalmia, or just any eye infections, okay? Vitamin K is to prevent bleeding, right? Because they have a premature liver and they don't have clotting factors. So this is going to help to make sure that in the event something does happen, that they're not like hemorrhaging. Hepatitis B vaccine is administered between 12 and 24 hours after birth. I know that there is some discourse on the B vaccine, but textbooks still say within 12 to 24 hours. I will still say within 12 to 24 hours. Obviously, it can be up to the discretion of the parent, and sometimes it varies state by state. Um, but the CDC's recommendation for that is not going to be what I'm teaching you guys, um, even when we go into PEDS. CDC's recommendations for vaccines, I'm not really listening to. I will listen to the American Pediatric Association. Okay. And then for mom, we're going to give Rogaine within 72 hours if she's Rh negative and the baby is Rh positive. All right, so reactivity periods. Newborns tend to go through pretty predictable periods of reactivity. You may be like, what does that mean? So in that first period, it's going to last about 15 to 30 minutes after birth. The baby's going to be alert. They're going to be active. They could have a rapid heart rate and some rapid respirations as well. They could try to like make some sucking sounds, seem like they're feeding, that sort of thing. There's also then going to be a period of what we call relative inactivity, where the baby's going to go to sleep for maybe about 30 minutes to 2 hours. And then there's going to be another period of reactivity. This is about 2 to 8 hours after birth. The babies may gag because they have some mucus from um, birth and whatnot. They may cry, that sort of thing. But this is a good sign. We want to see them being active and then resting, being active and then resting. Okay, so safety. Safety is always going to be a top priority for our neonates. Moms and dads, mostly moms, right? Primarily moms, are going to receive footprints and ID bands. Parents are going to have a matching ID band, and anyone who wants to come onto the unit is normally going to have a pink labeled um, visitor tag. Okay. Also, a lot of units now have what we call a Huggy security tag. It's going to be on the baby's foot and just helps prevent any elopement of the child. And then all of these units are locked too, which helps further for protection. No one can leave the unit with their baby unless they're being signed out, because, we have, or not signed out, but being discharged. There's protocol, right? Even for like procedures and stuff like that, there's protocols that we have to do because we don't want anyone leaving with the baby. So remember this. This is going to be very important for your tests. Okay. Highlight it, star it, do all the things. This is super duper important. Okay, so vital signs. So checking vital signs is going to be essential. Essential because they can help indicate early distress. We can use it to monitor the transition to extrauterine life, and it can also help us prevent complications. All right, so these next few slides are just like little charts of what's normal for the vital signs. Newborn heart rate is between 100 and 160. You could see 150 as well, beats per minute. It could drop to 100 when sleeping or rise up to 180 when you're crying or agitated. Persistent tachycardia or bradycardia is going to be concerning. And we're going to assess all of their pulses bilaterally, listen to their apical pulse for a full minute, and note any murmurs. We'll get into why we're assessing murmurs during this part more when we go into pediatrics. Okay, respirations. Normal respirations are 40 to 60 breaths per minute. Less than 25 is bradypnea. I can never say that. And then more than 60 is tachypnea. Newborn breathing is often going to be pretty shallow and irregular, so we like to watch for signs of distress with nasal flaring, grunting, humming. You may be like, humming, what do you mean? They will, if they're struggling to breathe, they can often sound like they're going, and that's them having difficulty breathing, or any sort of intercostal substernal retractions as well. All right, temperature. So a normal auxiliary temperature is 37 degrees Celsius. And then the kind of deviation is going to be 36.5 to 37.2. We have to make sure that because newborns lose heat so quickly, though, we're going to prevent heat loss as best as we can. So we're going to keep them in a warm environment. We're going to cover their head, cover their feet, places where heat tends to expel from the quickest. Drying the infant thoroughly, especially after birth, and encouraging skin to skin can help regulate temperature. Blood pressure. So, a normal newborn blood pressure is between 60 and 80 systolic, and diastolic can be between 40 and 50. Obviously, variations are going to occur with sleeping and crying or being agitated. Um, However, keep in mind that hypotension could be that they're becoming septic or they have hypovolemic shock. Another really good place to look at hypovolemia is going to be their fontanelles. If they're depressed, then it would make sense. We can see the decrease in the fluid volume. And then hypertension, specifically in the upper extremities and not in the lower extremities, is we're going to check both, could indicate, not lead, but indicate something called the cortication of the aorta. Again, we're going to talk about this more in pediatrics, but just know hypertension in upper extremities can lead to some sort of heart, not lead to, and be indicative of some sort of heart defect. And then, um, if a problem specifically is suspected for the heart defect, we are going to make sure that we assess all four extremities. Um, and we're going to make sure that we look at significant differences between the upper and the lower extremities. Okay, so the physical assessment. The newborn physical assessment is really going to establish the baseline kind of for the rest of their life. Um, Not really, maybe not the rest of their life, but how they should be, what's their normal, what's healthy for them, if that makes sense. So yeah, kind of the rest of their life. Um, Also it can help us detect some congenital abnormalities. Um, and it can help us identify anything that could be immediate or life-threatening. All right, so posture is one of the things that we're going to assess. Newborns should have general flexion and spontaneous movement. Their head, the head circumference should be 2 to 3 centimeters larger than their chest. We need to check their fontanelles, check for molding, cephalhematomas, and caput. I can never say that, sorry. Their eyes, their vision is going to be best within 12 inches. We're going to assess for strabismus or if they have pseudostrabismus. If it helps you guys remember strabismus as strabismus, I don't know if you guys have heard of that. I was in a cartoon when I was younger, and for the life of me right now, I can't remember, but strabismus. Um, Also some other things like subconjunctal hemorrhages, hematomas, that sort of thing. We'll talk about that more when we go to peds. And then congenital cataracts. Ears. We're going to check their placement, make sure that they're not too low. And then we're going to make sure that they're responding to voice and stimuli. For their nose, we're going to make sure that their nares are patent, and we need to remember that they're preferred nose breathers. And then their skin. We're going to look for acrocyanosis. Again, don't forget that this is a normal finding, but we do have to note it. Any jaundice, erythema, cafe au lait spots, port wine stains, stork bites, or strawberry marks, whatever you want to call it, burnix. We're all going to make sure that we note that and we document it. Okay. Oops. Sorry. And then these are the other 6 things that we look at, which is the mouth. We're looking for symmetry, soft and hard palate. Is that intact? We're going to go into cleft lip, cleft palate in pediatrics, but this is kind of an introduction to it. Their chest should be symmetrical and they should have well-formed nipples. Their abdomen, we're going to inspect the umbilical cord. If you do have to palpate their abdomen, just remember that you may be able to feel their liver, but that's a normal finding. Okay, musculoskeletal, we're going to change all of their, check all of their range of motion. We're going to see if they have any gluteal folds, any spinal alignment issues. We'll also look at the clavicles. It helps kind of with hip dysplasia, we'll talk more about, or like shoulder dystocia, that sort of thing. Okay, their genitalia, there are different normal findings that vary by sex, but do remember that for females, they can have a pseudo menstruation, and it's just because their body is kind of overwhelmed with hormones from mom. And then GIGU, newborns should be avoiding within 24 hours. Okay, and then they need to pass their meconium within 24 to 48 hours. All right, reflexes. Lots of different reflexes. Highly recommend you guys screenshot this chart. I think it's super duper helpful. Okay, so reflexes help us assess neurological function. It's going to include sucking, palmar and plantar, Moro, tonic, and Babinski. Okay. If we see them past, like occurring past the ages where these reflexes should have disappeared, it's going to indicate some sort of neurological issue. Like, for example, Babinski. If someone is an adult and they have a Babinski reflex, right, that's a really, really bad sign. And a lot of times it could be a sign that they could be brain dead. So just keep that in mind. If they're getting past, like too far past, and they still have some of these reflexes, that is a cause for concern. I'm not going to go over all the reflexes because I want you guys to make sure that you screenshot this, but I did want to note why it may be a bad thing to have these reflexes longer than the expected ages. Okay, bonding. Bonding is super duper important. Okay, so we want to promote bonding. Bonding is essential. It's super duper important to have parents hold their newborn to do skin to skin and interact very often and as early as possible. However, with that, we're also watching for any signs of disconnection or difficulty bonding. We want to provide support and then also look for things like postpartum depression with that. Okay, that could be one sign of postpartum depression. Mom just can't connect with her baby. All right. And these are my resources, as per always. And thank you. Um, that wraps up everything newborn care-ish. Obviously we have to go over some of the complications, but I feel like this was a pretty good introduction for you guys. There's some specialty things if you guys would like, I can give them to you. Um, like what we do for circumcision care, that sort of thing. But just let me know down in the comments if you guys want that. Um, but yeah, that's all I have for you guys today. I hope you have a great rest of your day and thanks for watching. Right, bye.